So the candidate has prepared a sterile tray and he's now placing his tourniquet and his sharp spin and his IV cannula on there. He's also going to gather his other equipment. He has his cannula dressing, his normal saline flush, remember to check the date on this, a 10 ml syringe, and some gauze swabs because there will be some blood, especially when you do the procedure in real life, and last but not least an alcohol swab. So the candidate is now washing his hands and he's doing it very thoroughly and he's making it making it very obvious so that the examiner knows he's washed his hands. He's now applied some clean gloves and he's feeling, so he's palpating for a suitable vein to insert the cannula. The next step, he's now going to prepare his saline flush. So gently draw back with the syringe as shown. Normally around 5 to 10 mils of normal saline will be enough. This bit is very important to make sure there's no air bubbles inside, so you gently bring the saline towards the tip and give the tip of the syringe a flick so that any bubbles will come out. And then you gently put it back into the packet to, of course, keep everything nice and sterile. For the next stage, the candidate is now going to apply the tourniquet above where he plans to cannulate, and you should let the patient know that they will feel some tightness as you tighten up your tourniquet. Now he's going to wash the area with an alcohol swab to make it nice and sterile, and good candidates normally put the gauze besides them because they know that there will be a bit of a flashback and blood, and so they prepare for that. Now this is the stage where you take the cannula sheath off and that will expose the cannula needle, as you can see. You then remove the plastic tip at the end of the cannula, which the candidate is now doing so, and hold the cannula as he demonstrates now. So he's got a nice comfortable position. Let the patient know there'll be a sharp scratch and gently guide the cannula in, and you can see that he's achieved flashback. That's when you know you're in the vein. Gently pull back and draw the plastic tube in, and then eventually the needle will come out. Okay, so he's gently secured that in. He's now going to place the gauze swab just underneath the cannula exit point. Now in the mannequin, the blood may not flow as fast as it would in a real patient, but of course it will mean that you avoid spilling any blood. The next step, make sure you expose of the needle in the sharp spin. Remove the tourniquet and apply your plastic cap. Remember, always keep that beside you so you know where it is, and you apply that cap. Now this can be quite fidgety for most candidates because you've got your gloves on and you've got the material of the mannequin, and it can often stick to your fingers. So stay nice and calm and gently screw it on as this candidate has demonstrated here. You then want to secure the cannula in place. So you will take off the 2 strips from the cannula dressing pack, one on one side and one is applied on the other side as shown here. And now the candidate will put the main dressing over the cannula. The top layer needs to be removed, and that will expose the underlying transparent cannula dressing. And you can see nice and tidy, and gently press down on this transparent dressing as well to make sure it's nice and secure. Next, of course, you've already prepared your normal saline flush, so you open the top of the cannula there, nice gently, and then you guide the saline in, and you can see that there's no resistance, so the saline is going through nicely, so you know you're in the vein. Close this off. Now the next stage is very important, and what you'll have to do is you put the date and time of the cannula, because different hospitals will have different protocols, but essentially the cannula normally will come out within 3 days.